a plastic surgery perspective that is mental health specific is body dysmorphia or body dysmorphic disorder. So it really is a mental health illness. And that's when somebody is fixated on some part of their body or their face, maybe a minor imperfection, or it doesn't even have to actually be an imperfection, something they perceive as this imperfection that they're just obsessed with. They spend an inordinate amount of time on it. It affects their life. It affects the way they communicate with their family, their job. Think about alcoholism. It stops you from going to work. It stops you from making money. It stops you from treating your family or helping your family. Body dysmorphia, people spend too much time and money and focus on whatever their perceived defect is. So, some of the things that elicit this or make this happen to people is definitely some sort of abuse, bullying. Bullying's a hot topic right now too. And those kind of things can really lead people to develop these body dysmorphic kind of tendencies. Obviously, a low self-esteem. You often see this in people who have self-esteem issues. There can be a fear of being rejected, or and I think probably these days, current time, the most common issue, the most common cause is this perfectionism, this comparing yourself to others. So, I think a key thing with the pandemic, everybody was, at home during this pandemic, right? We really weren't interacting with normal humans for almost 2 years. So we were interacting with the internet. We were on Instagram, TikTok, OnlyFans, all these other sites, and we were seeing this view of people, this almost avatar-like view with filters and whatnot. And it made people really compare themselves to something that was not a reality. So I think the BDD, the body dysmorphic tendency, the body dysmorphia has really skyrocketed because of this. So, you're looking at a filtered photo of somebody, a touched up photo of Kim Kardashian. Kim Kardashian, photos don't get out of her unless they're touched up. I know people that their entire job is to edit photos for some of these famous people. So. Me also. This is completely edited. This isn't my natural face. But no, in all honesty, I think the body dysmorphia is much worse because of this social media age. It's much worse because it started with magazines and TV, right? You see people who think about hair and makeup. Before I do a big shoot, they give me hair and makeup. They're tricking you. It's part of the game. So, I think it's an important thing to kind of bring to discussion. Actually, there is a healthy way to look at your body and to change your body. There's a healthy way to do plastic surgery. There's a healthy way to do aesthetics and cosmetics. There's also an unhealthy way to do it. We try to do it as healthy as we can. I mean, it's our goal, it's our role, it's morally, and we're trained as surgeons, plastic surgeons, that way. That you don't want to operate. You don't want to really be working with people with body dysmorphia because they're never satisfied, number one. Number two, they can get themselves into more trouble. I tell a lot of patients, less is more. Really look at what you want, look why you want it, and let's figure out how to get you there safely. And I think that's a really key point to doing this stuff, doing it, having fun while we're doing it. The key to being a plastic surgeon, you really want happy patients. Without happy patients, it's just not fun. I mean, and I want to have fun at work. So I do my best to kind of weed out those people that I'm really not going to make happy. And the unfortunate part is, even if I tell someone, that's not correctable, you shouldn't mess with it, it doesn't look as bad as you think it does, they'll find somebody, and there's definitely a surgeon out there who will do something to them. So that's the unfortunate part about our field. And I think it's worth pointing that out. And this isn't a diss, but normally it's the people that aren't quite busy enough. So then they do things that they shouldn't be doing. So, that's what I have to say about that. And I think it's an important point to bring up again. And I think it can be dealt with properly. There's definitely, plastic surgery definitely makes people feel good and look good. But it can also be quite a problematic field. So, it's kind of a hot topic, and if you guys have any input or you want me to expand further, let me know. Dr. C, only plastic surgery. All right, cool. You stayed the whole video. Listen, like, subscribe, and you just get hotter from subscribing to my channel. That's the key. Hot is hot. Keep going. Like, subscribe, follow, whatever you got to do here. We'll see you around.